Nationwide this past week, 3 million Americans got their first COVID shot as fears of the contagious Delta variant ramp up too.
We encourage folks to get vaccinated because we want to get back to normal.
Stacey Chamberlain helps represent about 30,000 Oregon workers.
There are a lot of conversations happening.
She's executive director of Oregon Ask Me, a union for predominantly public employees and nonprofit workers. The union is working on the issues of COVID-19 vaccine mandates in workplaces and people who are unvaccinated.
What are some of those steps, do you feel, as we move forward?
We want to make sure that they have access, that there's incentives, and that there's education.
The union says during the pandemic, many workers have put in hundreds of hours of overtime.
It makes it really hard for folks to find time.
Incentives to get vaccinated could be paid time off, childcare support, or cash. With the Delta variant, Oregon hospitalizations are back into the hundreds, mostly with younger patients who are unvaccinated.
Now we know the science. We have a vaccine. This is a completely preventable problem.
Dr. David Zones helps oversee critical care at OHSU. The union says 85% of its members working there are vaccinated, but hesitancy among the rest of those workers and the public is creating a new problem as cases tick back up.
People are leaving the profession. They're exhausted. We already have a limited number of beds, and now we can't staff the beds that we have.
OHSU is working on a mandate, but Oregon is the only state with a law that prevents hospitals from requiring employees to get the vaccine.
We need more people to get vaccinated.
Governor Kate Brown is considering a special session that could reverse that law. She's also thinking about a vaccine mandate for state employees, like in California.
Healthy workplace creates a healthy state.
Federally, the Department of Veterans Affairs is requiring staff be vaccinated, but the White House is holding off for other agencies.
So a national vaccine requirement is not under consideration at this time.
Back locally, the city of Portland is another entity considering a vaccine requirement. Staff would have to show proof of vaccination or get weekly testing. And for workers who are still hesitant overall, the union emphasizes vaccines are not political.
How do you as an organization approach sort of that emotional response that people naturally have?
I think it's taking the time to understand where that person is coming from and trying to identify what that fear is. And sometimes we're just not going to get there.
The union and state say vaccine mandate decisions could roll out in the next few weeks. Galen Etlin, KGW News.